Hi everyone, this is Professor Sun Myung from the National Cancer Center, Graduate School of Cancer Science and Pathology. This is the first part of the Medical Terminology 3 of the spring semester Clinical Oncology. Now I'm going to talk about Chapter 9, Blood, Lymph, and Immune Systems. Key terms. First, anaphylaxis. Ana means against. Phylaxis means protection. So anaphylaxis means exaggerated life-threatening hypersensitivity reaction to a previously encountered antigen. Antibody is a protective protein produced by B lymphocytes in response to the presence of a foreign substance called an antigen, which the immune system regards as harmful to the host. Antigen is the substance that is recognized as harmful to the host and stimulates the formation of antibodies in an immunocompetent individual. Cellular immunity is acquired specific resistance mediated by T cells that produces reactive substances or directly exerts a cytotoxic effect on a cell that is identified as harmful. The host is an organism. Humoral immunity is acquired specific resistance mediated by B cells. Immunocompetent means to be able to develop an immune response. Immunopathology is a study of disease states associated with overactivity or underactivity of the immune response. Opportunistic infection. This is an infection occurring in a person with a weakened immune system and caused by a microorganism that under normal conditions would not bring about disease. Palliative treatment is the treatment that provides relief but not a cure. Serum is a liquid portion of blood that remains after the removal of fibrinogen. Now I'm going to talk about the anatomy and physiology of blood and immune systems. Blood, lymph, and immune systems share common cells, structures, and functions. First, the blood is the source of certain immune cells that locate, identify, and destroy disease-causing agents. Immune cells either actively engage in the destruction of the invading agent or produce proteins that seek out and tag it for destruction. They rely on lymph vessels and blood vessels to deliver the protective benefits to the entire body. They use lymph structures, the spleen and nose, to provide permanent or temporary lodging sites where they monitor the extracellular fluid of the body. The lymph system operates in close association with blood, returning lymph and immune substances back to the circulatory system for redelivery to the entire blood. The blood is a connective tissue composed of a liquid medium called plasma, in which solid components are suspended. There are several solid components: erythrocytes, which is red blood cells, RBCs; leukocytes, which are white blood cells, WBCs; and the cell fragments called thrombocytes, which are platelets. So please remember the three solid components: RBCs, WBCs, and platelets. The blood cells are formed in the bone marrow, tissue of the skull, ribs, sternum, vertebra, and pelvis, as well as at the ends of the long bones of the arms and legs. Blood cells develop from an undifferentiated cell called a stem cell. Hematopoiesis or hematopoiesis This means the development and maturation of blood cells. As I mentioned before, there are three types of blood components. When blood cells are mature, they enter the circulatory system. The RBC transports oxygen and carbon dioxide. The WBC provides defenses against invasion by foreign substances and aid in tissue repair. The platelets provide the mechanisms for blood coagulation in case the blood vessels become severed. Although it makes up only about 8% of all body tissues, blood is essential to life. Figure 9-1 shows the blood composition. You can see a test tube containing blood. The upper part is the plasma, which is 55% of the total volume, and the lower part is the formed element, which is 45% of total volume, and the lower part usually contains the solid parts. For example, erythrocytes, RBCs, and thrombocytes, platelets, and the remaining cells are leukocytes. For example, monocyte, lymphocyte, neutrophil, eosinophil, and basophil. This figure 9-2 shows hematopoiesis. First, in the bone marrow of the bone, the stem cell develops to the next level cells. For example, from the stem cell, erythroblast, myoblast, monoblast, and lymphoblast develop. And then erythroblast develops to the normoblast, myoblast develops to myelocytes, metamyelocytes, monoblast develops to promonocyte, lymphoblast develops in thymus, and the megakaryoblast develops to the next level. And these primitive cells enter into the circulatory system in the blood. So the normoblast develops to the reticulocyte, and then the erythrocytes, RBCs. And metamyelocytes develop to the band cells. And among the band cells, there are three types of blood cells: basophil, neutrophil, and eosinophil. And the promonocyte develops to the monocyte in the circulatory system. And lymphoblast develops to the NK cell, natural killer cell, B lymphocyte, and T lymphocyte. And megakaryoblast from the bone marrow develops to the megakaryocyte, and then finally platelets in the circulatory system. And so in the tissues you can see various types of blood cells. For example, from the basophil, the mast cell can develop, and neutrophil, eosinophil. Monocyte develops to macrophage, and from the B lymphocyte, the plasma cell develops. And then the remaining ones are T lymphocyte and platelets. First, I'm going to talk about erythrocytes, which are RBCs. Erythro means red. Cyte means cells. So red blood cells. RBCs are the most numerous of the circulating blood cells. They resemble a biconcave disc in the mature form. The hemoglobin is a specialized iron-containing compound that gives RBCs their red color. It carries oxygen to body tissues and exchanges it for carbon dioxide, CO2. There are the millions of hemoglobin molecules in each of the billions of RBCs. Reticulocytes. During development, RBCs decrease in size, and just before maturity, the nucleus is extruded from the cell, leaving behind a small fragment of nuclear material that resembles a fine lace net, giving this cell its name reticulocyte. Although a few reticulocytes are found in circulation, most erythrocytes lose their nuclear material prior to entering the circulatory system, and the lifespan of RBC is about 120 days, which is about 4 months, and then rupture, releasing hemoglobin and cell fragments. Hemoglobin breaks down into hemostarin, which is an iron compound, and also several bile pigments. Most hemosiderin returns to the bone marrow and is reused to manufacture new blood cells. The liver eventually excretes the bile pigments. Leukocytes, WBCs. The chief functions of WBCs include protecting the body against the invasion by bacteria and foreign substances, removing debris from injured tissue, and aiding in the healing process. Whereas RBCs remain in the bloodstream, WBCs are able to migrate through the endocellular walls of capillaries and venules and enter tissue spaces through a process called diapedesis. That they can initiate inflammatory or immune responses at sites of injury or infection. This figure 9-3 shows diapedesis. Here, in the blood vessel, you can see erythrocytes, and also you can see another blood cells. Here, as I mentioned before, WBC are able to migrate through the endocellular walls of capillaries and venules and enter tissue spaces through a process called diapedesis. So here, this is neutrophil. You can see the process of diapedesis. The neutrophil goes out through the endocellular cell of the blood vessels, and then in the tissue, the neutrophil eats bacteria and eliminates. WBCs are divided into two groups, granulocytes and agranulocytes. The granulocyte is the most abundant type of leukocyte. Granulocytes contain granules in their cytoplasm and in their mature form exhibit a multi-lobed nucleus, which is called polymorphonuclear. There are three types of granulocytes: neutrophils, eosinophils, and basophils. These names are derived from the type of dye that stains their cytoplasmic granules when a blood smear is stained in the laboratory. First, neutrophils, which are ones of the granulocytes. The neutrophils are the most numerous circulating type of leukocyte. They are very motile and highly phagocytic, permitting them to ingest and devour bacteria and other particulate matters. And this is the first cell to appear at a site of injury or infection to begin the work of phagocytizing foreign material. Their importance in body protection cannot be underestimated. Someone with a serious deficiency of this blood cell type will die, despite protective attempts by other body defenses. This figure shows phagocytosis. Here, at the 11th direction, you can see the neutrophil eats bacteria, and this shows engulfment by endocytosis, and phagosome forms. As you can see here, you can see the phagosome, and lysosomes merge. So this forms phagolysosome. In this stage, the killing and digestion occur, and then in the final stage you can see the post-digestion, and debris comes out. And the next ones, eosinophils and basophils. The eosinophils protect the body by releasing many substances capable of neutralizing toxic compounds, especially of a chemical nature. Eosinophils increase in number during allergic reactions and animal parasite infestations. Basophils release histamines and heparin when tissue is damaged. Histamines initiate inflammation, leading to increased blood flow. This brings additional blood cells to injured areas to help in damage containment and tissue repair. Heparin acts to prevent blood from clotting. Now I'm going to talk about agranulocytes. First, monocytes. These arise in the bone marrow from stem cells. They are frequently called mononuclear leukocytes because their nuclei do not form lobes. They include monocytes and lymphocytes. First, monocytes are mildly phagocytic when found within blood vessels. They transform into macrophages. They play a chief role in many activities associated with its specific immunity. And lymphocytes include B cells, T cells, and natural killer cells. B cells and T cells provide a specialized type of defense called the specific immune response. This mode of protection is custom-made and aimed at a specific antigen. There are two types of immunity: humoral immunity by B cells and cellular immunity by T cells. And the natural killer cells highly are effective against cancer cells and other infected cells. They release potent chemicals that destroy these aberrant cells. Aberrant means departing from the normal course. Now, this table shows the protective actions of white blood cells. So, among granulocytes, there are three types of ones: neutrophils, eosinophils, basophils. Neutrophils have an action of phagocytosis. The eosinophils have the action of allergy, and the eosinophils act against allergy and animal parasites. The basophils have a role of inflammation mediators. And among agranulocytes, there are monocytes and lymphocytes. Monocytes have an action of phagocytosis, and the lymphocytes, B cells, has humoral immunity. T cells has cellular immunity. Natural killer cells has destruction without specificity. And now I'm going to talk about platelets. These are the smallest formed elements found in blood. Sometimes they are called thrombocytes, but not true cells, as this term erroneously suggests, but merely fragments of cells. They initiate blood clotting, homeostasis, when injury occurs. Blood clotting is a chain of interlinked reactions as follows. First, thromboplastin. These are released by traumatized tissue or ruptured platelets. And then, thromboplastin and other blood clotting factors combine with calcium ions to form prothrombin activator. And then, prothrombin activator reacts with prothrombin and calcium ions to form thrombin. The thrombin converts the soluble blood protein fibrinogen to fibrin, an insoluble protein that forms a protein net entangling blood cells and platelets. This gel-like mass of fibrin blood cells and platelets is known as a blood clot. And the plasma, the liquid portion of the blood in which blood cells are suspended. This is the plasma. When blood cells are absent, plasma is a thin, almost colorless fluid. The plasma is composed of about 92% water and contains proteins, albumins, globulins, and fibrinogen, gases, nutrients, salts, hormones, and excretory products. The plasma makes possible the chemical communication between all body cells by transporting these products to all parts of the body. And there is this concept, the serum. The serum is a product of blood plasma and differs from plasma in that the clotting elements have been removed. When a blood sample is placed in a test tube and permitted to clot, the resulting clear fluid that remains after the clot is removed is serum, because fibrinogen and the other clotting elements are used to form the clot. And now I'm going to talk about the blood groups. The human blood is divided into 4 groups based on the presence or absence of specific antigens on the surface of RBCs. There are 4 blood groups, A, B, AB, and O. They are identified the presence or absence of these antigens. In each of these 4 blood groups, the plasma does not contain the antibody against the antigen that is present on the RBCs. Rather, it contains the opposite antibodies. These antibodies occur naturally, that is, they are present or develop shortly after birth, even though there has been no previous exposure to the antigen. There are numerous other antigens that may be present on RBCs. Rh blood factor is implicated in hemolytic disease of the newborn caused by an incompatibility between maternal and fetal blood. Blood groups are medically important in transfusions, transplants, and maternal-fetal incompatibilities. This table shows the ABO system. Please remember and memorize this table. And person population varies by country or race. First, the blood type A has an antigen on the RBC surfaces A, and in the plasma there are anti-B antibodies. In blood type B, they have antigen B on the RBC surfaces, and there are anti-A antibodies in the plasma. As for blood type AB, they have A and B antigens on the RBC surfaces, but there is no antibody in the plasma for antigen A and B. Lastly, the blood type O, they have no antigen on the RBCs, but in the plasma there are both anti-A and anti-B antibodies. Now I'm going to talk about lymph system. The lymph system consists of a fluid called lymph, in which lymphocytes and monocytes are suspended, a network of transporting vessels called lymph vessels, and the multiplicity of other structures including nose, spleen, thymus, and tonsils. First, lymph vessels. This is a one-way transport system that begin as capillaries within tissues, which gradually increase in size as they transport lymph to the bloodstream. There are several functions of the lymph system. First one is maintain the fluid balance of the body by draining extracellular fluid from tissue spaces and returning it to the blood. Second is to transport lipids away from the digestive organs for use by body tissues. Lastly, to filter and remove unwanted or infectious products in lymph nodes. Lymph vessels begin as closed-ended capillaries in tissue spaces and terminate at the right lymphatic duct and the thoracic duct in the chest cavity. The extracellular fluid, which is also known as interstitial or tissue fluid, is a small amount of plasma seeping out of blood capillaries. The extracellular fluid resembles plasma but contains slightly less protein, which carries needed products to tissue cells while removing their waste. When moving through tissues, it also collects cellular debris, bacteria, and particulate matter. The lymph. Eventually, extracellular fluid returns to blood capillaries or enters lymph capillaries. When entering a lymph capillary, it is called lymph. Lymph nodes. Before reaching its destination, it first enters lymph nodes. The lymph nodes serve as depositories for cellular debris. Macrophages phagocytize bacteria and other harmful material, while T cells and B cells exert their protective influence. When a local infection exists, the number of bacteria entering a node is so great and their destruction so powerful that the node frequently enlarges and becomes tender. And now I'm going to talk about the right lymphatic duct, which lymph vessels from the right chest and arm join. And the right lymphatic duct drains into the right subclavian vein, a major vessel in the cardiovascular system. The lymph from all other parts of the body enters the thoracic duct and drains into the left subclavian vein. There are three organs associated with the lymphatic system: spleen, thymus gland, and tonsils. The spleen, like lymph nodes, acts as a filter. Phagocytic cells within the spleen lining remove cellular debris, bacteria, parasites, and other infectious agents. The spleen also destroys old RBCs and serves as a repository for healthy blood cells that are placed into circulation when needed. The thymus gland is located in the upper part of the chest, mediastinum. The thymus gland partially controls the immune system by transporting lymphocytes into T cells, the cell responsible for cellular immunity. The tonsils are the masses of lymphatic tissue located in the pharynx. They act as a filter to protect the upper respiratory structures when invasion by pathogens. This shows the lymph system. A, you can see the capillary, and in the B, you can see the lymph node. The main lymph systems are like this. Number 10, tonsil and cervical node, submandibular node, and as you can see here in the chest, there are several lymph systems: the thoracic duct, left subclavian vein, thymus, and right side you can see the right lymphatic duct, and also there is the thoracic duct, and also there is a spleen. And in the leg low extremities you can see the inguinal lobe, and also throughout the body you can see the lymphatic vessels. The immune system. First, resistance. Although exposed to a vast number of harmful substances, most people suffer relatively few diseases throughout their lives. The numerous body defenses work together to protect against disease. The resistance includes physical barriers like skin and mucous membranes, and the chemical and cellular barriers like tears, saliva, gastric juices, and neutrophils present at birth. Acquired immune response develops after birth and the most complex in both structure and function. The acquired immune response develops throughout life as a result of exposure to one disease after another. With each exposure, the immune system identifies the invader, which is an antigen, musters a unique response to destroy it, and then retreats with the memory of both the invader and the method of destruction. And the WBCs is responsible for the specific immune response in monocytes and lymphocytes. First, monocytes. After a brief stay in the vascular system, monocytes enter tissue spaces and become highly phagocytic macrophages. The macrophages consume large numbers of bacteria and other antigens and process these substances and place their antigenic property on their cell surface, thus becoming antigen-presenting cells, APC. The APC awaits an encounter with an immunocompetent lymphocyte, which means one capable of responding to the specific antigen to initiate the specific immune response. There are two types of lymphocytes, B cells and T cells. They are the active cells in the acquired immune response. Each mediates a specific response, humoral or cellular immunity. First, humoral immunity. In Latin, this humor means body fluid. The humoral immunity protects primarily against extracellular antigens such as bacteria and viruses that have not yet entered the cell. The humoral immunity is mediated by B cells, which originate and mature in the bone marrow. During maturation, B cells develop receptors for a specific antigen. Upon an encounter with the specific antigen, B cells produce a clone of cells called plasma cells, producing proteins called antibodies. Antibodies enter the circulatory system and travel throughout the body in plasma, tissue fluid, and lymph. When encountering the specific antigen, they form an antigen-antibody complex that inactivates, neutralizes, or tags the antigen for destruction. All these reactions are highly specific. That is, the antibody reacts only against the specific antigen that caused its formation, a characteristic called specificity. After the encounter, B memory cells migrate to lymph tissue and are available for immediate recall should the antigen be encountered again. And now I'm going to talk about cellular immunity. The cellular immunity protects primarily against intracellular antigens such as viruses and also has the ability to destroy cancer cells. The cellular immunity is mediated by T cells, which originate in the bone marrow but migrate and mature in thymus. There are 4 types of T cells: cytotoxic T cell, TC, helper T cell, TH, suppressor T cell, TS, and memory T cell, TM. First, the TC, cytotoxic T cell, is the cell that actually destroys the invading antigen. This determines its specific weakness and uses this weakness as a point of attack to destroy the antigen. The helper T cell, TH, is essential to the proper functioning of both humoral and cellular immunity. This activates other cells of the immune system using chemical messengers called cytokines. If unavailable, the immune system essentially shuts down and the patient becomes a victim of even the most harmless organisms and eventually dies. The TS, suppressed T cell, monitors the progression of the infection. When the infection is resolved, the TS suppresses or shuts down the immune system until the next encounter with an antigen. Finally, TM means memory T cell. Like the humoral response, the cellular response also produces memory cells. TM cells find their way to the lymph system and remain there long after the encounter with the antigen. Memory cells are unique to the acquired immune system. They are able to recall how the B cells and T cells previously disposed of the antigen and are able to repeat the process. Disposing of the antigen during the second and all subsequent exposures is extremely rapid and much more effective than it was during the first exposure. The natural killer cell, NK cell, works independently of the specific immune response. The natural killer cell will attack any cell that appears abnormal and does not require the specificity needed by T cells and B cells. Although they have the ability to kill over and over again, they do not have a memory component like B cells and T cells. This table shows the summary of the humoral immunity and cellular immunity. Now I'm going to talk about medical word elements. Adeno means gland. So adenoid is having the appearance or resembling a gland. Oid, OID, means resembling. Agglutinin means clumping, gluing. So agglutination is the process of clumping. Basal means alkaline, which is opposite of acid. Basophil is the granulocytic white blood cell whose granules have an attraction for alkaline dyes. Phil means attraction for. Blast means the embryonic cell. Erythroblastosis is an abnormal condition marked by embryonic red cells in circulating blood. Chrome means color. Hypochromic refers to red blood cells with less color than normal. Eosinophil means dawn. Eosinophil means granulocytic leukocyte whose granules have an attraction for eosin. Erythro means red, erythrocyte. Granule means granule. Granulocyte is the group of leukocytes that have cytoplasmic granules. Hem or hemato means blood. Immuno means immune. Kary, K-A-R-Y, and nucleo, N-U-C-L-E-O, nucleo means nucleus. Leuc means white, so leukemia is any of several types of malignancy that affect white blood cells. Lymphadeno means lymph gland. Lymphadenopathy is any disease of lymph nodes. Pathy means disease. Lymph means lymph. Lymphangy means lymph vessels. Morph means shape. So morphology is the study of form, shape, and structure. Myelo means bone marrow. So myelogenic is relating to or having origin in bone marrow. Neutral means neutral. Phag means swallowing, eating. Phagocyte means the cell that surrounds, engulfs, and digests microorganisms and cellular debris. Plasma means growth or formation. Poikilo means buried, irregular. So poikilocytosis means abnormal increase in red blood cells that are irregular in shape. Reticular means net, mesh. So reticulocyte is an immature erythrocyte characterized by a mesh-like pattern of threads and particles at the former side of the nucleus. Stero means iron. SER, serum means serum. So serology is the study of the serum components of blood. Spleen means spleen. Thromb means blood clot. So thrombocytosis is the abnormal increase in the number of platelets in the blood. Thyme means thymus gland. Geno means foreign. Genograft means the transplantation of tissues from one species to another, which is also called heterograft. Suffixes. Blast means embryonic cells. So erythroblast is the embryonic red blood cells. Anemia means blood condition. Anemia is the blood condition characterized by a reduction in the number of RBCs. Globin is protein. So hemoglobin is the blood protein found in erythrocytes. Graft means transplantation. Oocyst means abnormal condition. So leukocytosis is abnormal increase in white blood cells. Penia means decrease. So erythropenia is the opposite concept from the leukocytosis. Phil means attraction for. Phoresis means carrying. Phylaxis is protection. So anaphylaxis is an exaggerated life-threatening hypersensitivity reaction to a previously encountered antigen. Poiesis means formation. Stasis means standing still. In prefixes, A means without. Allo means differing from the normal. Allograft is the graft transplanted between genetically non-identical individuals of the same species. This is also called homograft. Uniso means unequal. Iso means same. Macro, large. Micro, small. Mono, one. Poly, many. In pathology, there are some pathology conditions associated with blood, anemia, leukemia, and coagulation disorders. These pathology typically shares common signs and symptoms that generally include paleness, weakness, shortness of breath, and heart palpitations. Lymphatic disorders are commonly associated with edema and lymphadenopathy. Usually, the tissues are swollen with enlarged tender nodes. Immunopathies means immunologic disorders, either abnormally heightened immune responses to antigens like allergies, hypersensitivities, and autoimmune disorders, or abnormally depressed responses, immunodeficiencies, and cancers. Many immunology disorders are manifested in other body systems. For example, asthma and hay fever. These are immunology disorders that affect the respiratory system. Atopic dermatitis and eczema are immunology disorders that affect the integumentary system. Rheumatoid arthritis, cancer, and AIDS are caused by disordered immunity. Hematology is the branch of medicine that studies blood cells, blood clotting mechanisms, bone marrow, and lymph nodes. The hematologist is the physician who specializes in hematology. Allergy and immunology is the branch of medicine involving disorders of the immune system, including asthma and anaphylaxis, adverse reactions to drugs, autoimmune disease, organ transplantations, and malignancies of the immune system. First, anemia. Any condition in which the oxygen carrying capacity of blood is less than that required by the body. This is the anemia. There are several causes for anemia development. For example, excessive blood loss, excessive blood cell destruction, decreased blood formation, and faulty hemoglobin production. The anemia results from a decrease in the number of circulating RBCs, which is called erythropenia, amount of hemoglobin, hypochromasia within them, or volume of packed erythrocytes, hematocrit. Anemia commonly causes changes in the appearance of RBCs when observed microscopically. In the normal RBCs, the RBCs fall within a normal range for size, which is called normocytic, and the amount of hemoglobin, normochromic. But there are variations. The RBCs that are excessively large, which is called macrocytic, they can be excessively small, microcytic, or they have decreased amounts of hemoglobin, which is called hypochromic. There are common signs and symptoms in anemia. Difficulty breathing, which is called dyspnea. Weakness, rapid heartbeat, which is called tachycardia. Paleness, low blood pressure, hypertension, and commonly a slight fever. This chart lists various types of anemia along with descriptions and causes for each. Anaplastic anemia, folic acid deficiency anemia, hemolytic anemia, and hemorrhagic anemia. I'll skip this one. And also iron deficiency anemia, pernicious anemia, sickle cell anemia. The iron deficiency anemia is the most common type of anemia worldwide. This is caused by a greater demand on stored iron than can be supplied, commonly as a result of inadequate dietary iron intake or malabsorption of iron. Now I'm going to talk about acquired immunodeficiency syndrome, which is AIDS. This is a transmissible infectious disease caused by the human immunodeficiency virus, HIV, which slowly destroys the immune system. Eventually, the immune system becomes so weak, which is called immunocompromised, that in the final stage of the disease, the patient falls victim to infections that usually do not affect healthy individuals, which is called opportunistic infection. The symptoms of AIDS are swollen lymph glands, which is lymphadenopathy, malaise, fever, night sweats, and weight loss. And also, there are several diseases closely associated with AIDS, like they are Kaposi sarcoma, which is a neoplastic disorder, and pneumocystic cardiac pneumonia, PCP, which is one of the many types of pneumonia. The transmission of HIV occurs primarily through body fluids, mostly blood, semen, and vaginal secretions. This virus attacks the most important cell in the immune system, the Th cell, which is the helper T cell. Once you are infected by HIV, it becomes a mini factory for the replication of the virus. More importantly, the virus destroys the helper T cell, which is essential to both the humoral and cellular arms of the immune system. Without this cell, the entire acquired immune system completely closes down and the patient ultimately dies. Although there is no cure for HIV, there are highly effective treatments available that can significantly slow the progression of both the virus and the disease. However, many of the medications have a serious adverse effects, and once the decision for medical management is made, the patient should not discontinue treatment, as this causes the virus to become resistant. Now, I'm gonna talk about allergy. This is an acquired abnormal immune response. Allergy requires initial exposure to an allergen, which is an antigen, that causes an allergic response, which is called sensitization. And then the subsequent exposures to the allergen produce increasing allergic reactions that cause a broad range of inflammatory changes. One common manifestation is hives, which is also called urticaria. Other manifestations include eczema, allergic rhinitis, coryza, asthma, and the extreme anaphylactic shock, which is a life-threatening condition. There are allergy sensitivity tests. These are the tests for identifying the offending allergens. Usually, small scratches are made on the patient's back, and the liquid suspension of the allergen is introduced into the scratch. If antibodies to the allergen are present in the patient, the scratch becomes red, swollen, and hardened or indurated. Desensitization is repeated injections of a dilute solution containing the allergen. The initial concentration of the solution is too weak to cause symptoms. Additional exposure to higher concentrations promotes tolerance of the allergen. The autoimmunity is a phenomenon led by failure of the body to distinguish accurately between self and non-self. The immune system attacks the antigens found on its own cells to such an extent that tissue injury results. There are several types of autoimmune disorders. These range from those that affect only a single organ to those that affect many organs and tissues, multisystemic. Myasthenia gravis is one of the autoimmune disorders that affects the neuromuscular junction. This usually involves muscles of the limbs and eyes and those affecting speech and swallowing. There are also other autoimmune diseases like rheumatoid arthritis, idiopathic thrombocytopenic purpura, ITP, vasculitis, and systemic lupus erythematosus, SLE. Treatment consists of attempting to reach a balance between suppressing the immune response to avoid tissue damage while still maintaining the immune mechanism sufficiently to protect against disease. They have periods of flare-up, exacerbations, and latency, remissions. They are commonly chronic and requiring lifelong care and monitoring even when the person may look or feel well. Edema is an abnormal accumulation of fluids in the intercellular spaces of the body. There are several causes for edema. A decrease in the blood protein level, hypoproteinemia, especially albumin, which controls the amount of plasma leaving the vascular system. And also, other causes are poor lymph drainage, high sodium intake, increased capillary permeability, and heart failure. The treatment for edema is limited to a specific area, localized. They are the elevation of the body part and the application of cold packs. For the systemic edema, we can use medications that promote urination, diuretics. As for ascites, in which fluid collects within the peritoneal or pleural cavity, there are several causes for ascites: interference in venous return during cardiac disease, obstruction of lymphatic flow, disturbances in electrolyte balance, and also usually liver disease. In oncology, there are several oncological disorders associated with the blood, lymph, and immune systems. They are leukemia, Hodgkin disease, and Kaposi sarcoma. Leukemia is an oncological disorder of the blood-forming organs characterized by an overgrowth or proliferation of blood cells. Malignant cells replace healthy bone marrow cells. Leukemia is categorized by the type of leukocyte population affected: granulocytic or lymphocytic, or myelogenous or lymphogenous. They can be either chronic or acute. In acute form, the cells are highly embryonic, plastic, and lack mature forms, resulting in severe anemia, infections, and bleeding disorders. They are commonly life-threatening. The specific causes of leukemia are unknown, but viruses, environmental conditions, high-dose radiation, and genetic factors have been implicated. We can make a diagnosis by using bone marrow aspiration and bone marrow biopsy. For the treatment, we can use one or more of the following treatment options: chemotherapy with one or more of the anti-cancer drugs, radiation, biologic therapy, and bone marrow transplant. If left untreated, leukemias are fatal. Second, Hodgkin disease or Hodgkin lymphoma. This is a malignant disease that affects the lymphatic system, primarily the lymph nodes. It may spread to the spleen, GI tract, liver, or bone marrow. Symptoms usually begin with painless enlargement of lymph nodes, typically on one side of the neck, chest, or underarm. Also, extreme itching, pruritus, weight loss, progressive anemia, and fever can develop. If nodes in the neck become excessively large, they may press on the trachea, causing difficulty in breathing, dyspnea, or on the esophagus, causing difficulty in the swallowing, which is called dysphagia. The treatment for Hodgkin disease, there are several options: radiation, chemotherapy, and bone marrow transplants, and they are highly effective. And now, Kaposi sarcoma is a malignancy of connective tissue, including bone, fat, muscle, and fibrous tissues. The Kaposi sarcoma is closely associated with AIDS and is commonly fatal because the tumors readily metastasize to various organs. Usually, the treatment for AIDS-related Kaposi sarcoma is palliative, relieving the pain and discomfort that accompany the lesions, but there is little evidence that it prolongs life. And now I'm going to talk about the diagnostic, symptomatic, and related terms. Anisocytosis. On means without, iso means same, site means cell, oocyst means abnormal condition. So, anisocytosis is the condition of marked variation in the size of erythrocytes when observed on a blood smear. Ascites is the accumulation of serous fluid in the peritoneal or pleural cavity. Bacteremia is the presence of viable bacteria circulating in the bloodstream. Graft rejection is the recipient's immune system attacks a transplanted organ or tissue, resulting in its destruction. Graft versus host reaction, GVHR, is the condition that occurs following bone marrow transplants, where the immune cells in the transplanted marrow produce antibodies against the host tissues. Hematoma is the localized accumulation of blood. Hemoglobinopathy is any disorder caused by abnormalities in the hemoglobin molecule. Hemolysis means destruction of RBCs. Hemostasis is the arrest of bleeding or circulation. Immunity is the state of being protected against infectious diseases. Lymphadenopathy is any disease of the lymph nodes. Lymphosarcoma is the malignant neoplastic disorder of lymphatic tissue. Septicemia is systemic disease associated with the presence and persistence of pathogenic microorganisms or their toxins in the blood, which is also called blood infection. Serology is the blood test to detect the presence of antibodies, antigens, or immune substances. Titer means the blood test that measures the amount of antibodies in blood. Now, going to the diagnostic and therapeutic procedures. In the laboratory terms, APTT is the activated partial thromboplastin time. Blood culture is the test to determine the presence of pathogens in the bloodstream. CBC, this is commonly used term, complete blood count. This is a series of tests that includes hemoglobin, hematocrit, red blood cells, white blood cells, and platelet count. And also this includes differential WBC count, RBC indices, and RBC and WBC morphology. This is very useful for the diagnosis of some kind of leukemia or hematologic disorders. Differential count is the test that enumerates the distribution of WBCs in a stained blood smear by counting the different kinds of WBCs and reporting each as a percentage of the total examined. ESR, erythrocyte sedimentation rate. This is the measurement of the distance RBCs settle in 1 hour when whole blood is placed in a narrow tube. Hemoglobin, HB. This is the measurement of the amount of hemoglobin. Hematocrit is the measurement of the percentage of packed RBCs in a whole blood sample. Prothrombin time, PT, is the test used to evaluate portions of the coagulation system and indirectly measure prothrombin. RBC indices is the mathematical calculation of the size, volume, and concentration of hemoglobin for an average red blood cell. Schilling test is the test used to assess the absorption of radioactive vitamin B12 by the GI system. Radiographic terminology. Lymphadenopathy. Lymphadenography is the radiographic examination of lymph nodes after injection of a contrast medium. Lymphangiography is the radiographic examination of lymph nodes or tissues after injection of contrast medium in in lymph vessels. Aspiration is to draw in or out using suction. So bone marrow aspiration is the procedure using a syringe with a thin aspirating needle that is inserted to withdraw a small sample of bone marrow fluid for microscopic evaluation. This bone marrow aspiration is used to diagnose hematologic disorders like leukemia or lymphoma. And the biopsy. The bone marrow biopsy is the removal of a small core sample of tissue from bone marrow. Lymphangectomy is the removal of a lymph vessel. Transfusion is injecting of blood or blood components into the bloodstream. Autologous transfusion is the transfusion prepared from the recipient's own blood. Homologous transfusion is the transfusion prepared from another individual whose blood is compatible with that of the recipient. And transplantation is the grafting or leaving tissue from its normal position to another site or from one person to another. Autologous bone marrow transplantation and homologous bone marrow transplantation. In the pharmacology, there are several drugs used to treat blood, lymph, and immune disorders. Anticoagulants prevent blood clot formation by inhibiting one or more clotting factors. And there are several anticoagulants like heparin, warfarin. And also there are antineoplastics, antiprotozoals, antibiotics and sulfa drugs, antivirals, fat-soluble vitamins, hemostatics, and thrombolytics. Now, this will be the last part of this lecture. Abbreviations. AB, antibodies. ABO, blood groups A, AB, B, and O. A is acquired immunodeficiency syndrome. ALL, acute lymphocytic leukemia. AML, acute myelogenous leukemia. APTT, activated partial thromboplastin time. CBC, complete blood count. CLL, chronic lymphocytic leukemia. CML, chronic myelogenous leukemia. EBV, Epstein-Barr virus. ESR, erythrocyte sedimentation rate. HB, hemoglobin. HCT, hematocrit. HIV, human immunodeficiency virus. IgGs, immunoglobulins, antibodies. ITP, idiopathic thrombocytopenia purpura. IV, intravenous. Lymph nodes, lymphocytes. MCH, mean corpuscular hemoglobin. MCHC, mean cell hemoglobin concentration. MCV, mean cell volume. PA, posterior anterior, or in the hematology, pernicious anemia. PMN means polymorphonuclear leukocyte. PT, prothrombin time. PTT, partial thromboplastin time. RBC, red blood cells. SLE, systemic lupus erythematosus. WBC, white blood cells. Okay, this is it. So in the next video, I'm going to talk about the musculoskeletal system of the medical terminology 3. Bye.